Zikomo. Allow me, Your Excellency, distinguished ladies and gentlemen, to move on to the other part, recognizing Medical Association of Malawi, their members there that did very well and continue to do very well in the fight against the pandemic. We'll start with Dr. Tamara Phiri, specialist in internal medicine from the Queen Elizabeth Central Hospital. There she is. Tamara is the clinical lead of COVID-19 at Queen's, where she has distinguished herself as a doctor, showing a positive attitude to patients and colleagues. Congratulations, Zikomo. Performance. Your Excellency, distinguished ladies and gentlemen, allow me now to invite three people in front. I'll start with Dr. Tamara Phiri. Others might not understand why the Zikomo Presidential Awards. Why are we awarding these great men and women? But if we get to hear them, get their experiences, how it has been for the last 12 years, maybe then we can appreciate how much these awards mean to the health sector. Please do come forward. I would ask you a few questions, joined by my colleague here, Martha, so that we hear your experiences. Martha, over to you.
Thank you very much, Your Excellency, distinguished guests, ladies and gentlemen. I have Dr. Tamara Phiri here, and perhaps the question that I would ask is, what was your experience like this past year?
Good evening, Your Excellency, Dr. Lazarus Chakwera, and all distinguished guests. My name is Tamara Phiri. I'm a doctor, and I'm also a specialist in internal medicine. For the last year and a half, I've led a clinical team at Queen Elizabeth Central Hospital in setting up, running, and looking after COVID patients. And I want to spend a few moments sharing with you my experiences, what we've learned, and also what we think the future should look like. And to start with, I want to highlight that our teams are big. We also have clinical officers and medical assistants whose importance cannot be overestimated. We also have a big team that works behind us who probably don't get acknowledged as the doctors and nurses. We've got laboratory personnel, and without those people, we would not have the COVID statistics that we get every day. And every time you hear about a positive COVID case that's been reported, you should know that there is a laboratory personnel that's been exposed to that person that they've tested. I also want to highlight the importance of people from radiology. Without their x-rays, without their scans, we wouldn't know what COVID looks like inside the body. I want to highlight the importance of the pharmacists who make sure that we have drugs for our patients as we treat them. And Your Excellency, I also want to highlight a team that really works behind, that we don't see them. This includes patient attendants, the cleaners in our wards, the porters. These people are doing an exceptional job, and I think they are our unsung heroes. Your Excellency, I've looked after some of the sickest COVID patients over the past year, and from them, I've learned a lot, which I want to share. Your Excellency, if you talk to any patient that's been admitted in a COVID ward, they will tell you it's one of the scariest experiences that they've had in their lives, and that there were many days when they thought they might not leave the hospital. And to work and save such people, it has forced us as healthcare workers to go beyond our call of duty. It has taught us that we're not only there to give medication and oxygen, but also to give our patients hope. There were days when instead of knocking off and leaving the wards, we had to stay by the bedside and hold these patients' hands and tell them that they were going to be okay and that they were going to leave the hospital alive. And Your Excellency, I am pleased to say that of the many people that we admit, a lot of them have left the hospital alive. And I am very encouraged when I meet such patients who were at the brink of death and now they're back and they're working, And it's very encouraging when we get patients that come back to say thank you. And even those who we never meet again, we celebrate when we hear that they are well. Your Excellency, I have been encouraged not only by the patients, but also by my fellow healthcare workers. Every time we go into a COVID ward, we are putting our lives at risk, and we are putting our lives on the line. And by serving those COVID patients, we ourselves might become COVID patients just like them. We've seen our colleagues, doctors, nurses that have gotten sick and some that have died of COVID in this country and abroad. But I see these people that still come back to work and come and work on these wards day after day, and I am very moved by their dedication. And Your Excellency, even though these people are doing such a good job and they are so strong, these people are human. They get tired, they get frustrated, they get demotivated when sometimes they don't see the output that they would like to see. And Your Excellency, the job that they're doing, they also need other humans to encourage them. And tonight, Your Excellency, I want to commend you because you've done this publicly. You've encouraged all of us, and you've shown that you take our interests at heart. When I share my experiences with people, some people say that our sacrifices are too big and that no one can reward us on earth and that our reward is in heaven. And interestingly, that was the first song that was sung here. But Your Excellency, you've gone beyond that, beyond just telling us that it's a calling. You've shown us visibly that you appreciate us and that you're going to reward us even while we're here. Your Excellency, I have seen how we've started from scratch with very little resources, and we've had to make do with what we have. And in my opinion, I think the most precious resource is the very few healthcare workers this country has. And I think they need to be looked after and protected and encouraged at all costs. Because if they get sick or if they die, there'll be no one to look after us and no one to look after the COVID patients and all the other problems that we've had. Your Excellency, on top of COVID, we've always had other health issues and we continue to have them. And I get told by a lot of people that we get too fixated on COVID and we shouldn't forget about the other health problems. And I agree with them because we've seen that one of the effects of COVID is it's increased the number of deaths of people who don't have COVID but are not able to access care because they are afraid or because the services are not running the way they normally do. Your Excellency, I have seen how COVID has challenged our norms and our culture. In our culture, we are very communal. When people are sick, we want to visit and be with them. When people die, we want to mourn and be with them. And COVID has changed all of that. And sometimes COVID patients get sick and deteriorate very, very quickly. And before the family even understands what has happened to their patient, this patient is dead. And you're faced with this family who doesn't understand what has happened to their loved one. And because we've changed everything and the narrative that we're saying is so different from our culture, we've met a lot of resistance. We've also been faced with verbal abuse and sometimes physical assault of the healthcare workers because people don't understand what's going on. Your Excellency, I want to highlight one lesson that I've learned from looking after COVID patients. COVID patients have taught me that you never give up. And I think we should learn from them as a people and as a country that we cannot give up. COVID comes very aggressively. It sweeps across the country quickly. It kills a lot of our friends. And I think when we respond to it, we should respond with the same swiftness and the same seriousness that it comes with. And I also started thinking about what we should do in the future. Clearly, we should plan, and because we live in a global community, we're going to be affected by global health issues like this and many others. And we should take the lessons that we've learned now and apply them going forwards. Your Excellency, we all know that there's always room for improvement in our infrastructure, in our service, and in the way we look after our patients. I want to end by emulating you, Your Excellency, and acknowledging the wonderful healthcare workers in this room and those that are not here with us who are just as deserving. Your Excellency, even as these men and women are sitting here, they're still talking about how much oxygen they have and if they have bed space to cover the increasing numbers of patients that we now are seeing. And even though they are very distinguishedly dressed now, in a few hours from now, they'll be back into their hospital scrubs and uniforms, back into the business of saving lives. And I really want to salute and applaud these people. Your Excellency, I want to thank you for this opportunity that's been given to me to talk and address you and also to address the whole nation of Malawi. I thank you.
Thank you very much, Dr. Tamara Phiri, for